fellow Kenyans, today, the 16th of April, 2020, marks exactly 1 month and 3 days since the first confirmed cases of the coronavirus disease was recorded in our country. As a government, and on the advice of medical and public health experts, we moved quickly to implement a comprehensive plan designed to limit individual exposure to the virus and its spread within our communities. We recognized the profound need for prompt action, observing the exponential nature of the pandemic's transmission that had been recorded in other countries across the world. The measures that we took are firm and indeed have been impactful. The nighttime curfew and the banning of travel in and out of the areas that have the most infections are indeed limiting the ability of the disease to be transmitted at a great scale. The same is also the case when it comes to social distancing. The guidelines that have been set out that include, amongst other things, the closure of learning and entertainment institutions, as well as the barring of air travel into our country. I want at this juncture to thank each and every one of you, all who have stepped up to be in compliance with these necessary measures, because your actions are, without doubt, saving lives. Without them, we would need to deal with a disease that is highly infectious and that can double and redouble its spread and cause untold human destruction. We have seen this happening in other countries. If we did not take strong and immediate steps, the damage to our people's lives and our economy, our country, would have been far worse than the current difficulties that we are going through now. Your compliance, fellow Kenyans, with distancing, wearing of masks, the hygiene advisories, these small and basic actions are protecting other Kenyans and even your own families. We love and respect our elderly fellow Kenyans, our grandmothers, our grandfathers. They are so vulnerable to this disease. So it is important that each one of us do the right thing and show our care for them by doing as our medical experts are advising us. Fellow Kenyans, our measures are slowing the rate the disease would be spreading, but we must be honest and say that there are still infections underway in nearly half of our counties. In the last 24 hours, we have conducted 704 tests, out of which 9 persons have tested positive for coronavirus. In that regard, the total number of persons who have tested positive now stands at 234. Fortunately for us, 53 persons have also turned negative and been discharged from hospital. We have lost 11 persons to this disease, and nearly 1,000 are still in quarantine, and 156 in isolation facilities. Fellow Kenyans, these are not just numbers, these are people, human beings. They range in age from 2 years to 64 years and come from every socio-economic group and multiple ethnicities and countries of origin. None of these people set out to be infected. We can all be infected if we are not extremely careful. Coronavirus is not a respecter of age, of status, of ethnicity or race, for we have even seen leaders of countries get infected and they've had to seek serious medical attention. Our response to this crisis, I believe, is revealing our skills and capabilities as a nation. One instance is in quickly escalating testing, which is key to detecting and dealing with a pandemic. Our testing capability has gone up dramatically, and we have tested over 10,000 individuals. This week, the Ministry of Health has received more testing reagents that will allow us to upscale our testing capacity, starting with targeted areas and eventually to the wider Kenyan population. We are grateful that we have seen innovation out of this crisis. For example, students at Kenyatta University need to be applauded for developing a prototype of an inexpensive ventilator for use in our local hospitals. Not to be left behind, other universities and technical institutions are also making remarkable progress in the local manufacture of medical technologies and equipment in support of our medical and public health needs that have arisen from COVID-19. With imports severely interrupted, I also want to applaud our local industry that has stepped into the gap. These efforts are reflected, for example, by the Kitui County Textile Company, the National Youth Service, who are producing face masks in large numbers. Others are like Shona, EPZ Limited, Betty Investments Limited in Nakuru, who are manufacturing the personal protection equipment for our medical workers on the front line. I encourage all those who are able to rally to supply this need, but also we need to ensure that those engaged in this manufacture pay heed to the standard required of these products. Other local industries have heeded the rallying call and diverted their regular commercial production to support Kenya's COVID-19 response by manufacturing soap and disinfectants for free distribution by government to frontline health institutions, vulnerable groups, and communities. These efforts are demonstrating our ability as a nation to be a stronger manufacturing nation that will ultimately create jobs and serve our nation, not just during this crisis, but into the future. This, I believe, will help all of us champion our agenda of expanding Kenya's manufacturing base. Now that these products are being manufactured locally, the focus for all purchasing parties should be to ensure that we procure these products domestically so that we can keep our enterprises and our workers growing and working.